Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right first molar. As you can see on the 3D rendering, this is a extracted to root ridge, the edentulous ridge. We can see there is a buccal defect here. On the panoramic view, we can see that there is a extracted root in the segment. On the transaxial view, we can see that there has been some form of grafting done, but the grafting is not absolutely completely adequate because we can see radio opacity lucencies or a hypodense area in the mesial segment. Now, for implant placement, the most ideal situation will be the placement of the implant in the interradicular bone. In the interradicular bone, we've placed a SS2 Ostem implant. We've kept a 6 implant diameter for maximum engagement in this area. We still have sufficient bone on the buccal and the lingual aspect, and because of the height, we've kept an 8.5 height of the implant. Now, the approximate height in this region is from the crest of the ridge is approximately 12 millimeters from the crest to the inferior alveolar nerve, and the width in this region approximately is 8.2 millimeters. Now we have adequate, absolutely adequate bone on the lingual aspect. We've got a D3 to D2 level of bone because we have good cortical plate, and the cancellous bone is minimal because of the extracted area. Now, once we place the implant in this region, here we go, we can see that even with the implant placement, we can see that we've got sufficient mesiodistal width. We've got enough place in the interdental area. On the 3D rendering, we can see that the implant is placed slightly lingually, and there will be need for augmentation on the buccal aspect once the implant is placed. Taking you to the axial view. On the axial view, you can clearly see that the implant here is placed, and we have absolutely good bone support on all around the implant. There we go. We've got good bone support here. We've got good bone support here. We can even narrow the implant and take it to 4.8 millimeters. But 4.8 and 6.0, both implants will be sufficient for placement in the lower right ridge. So if you have any further questions regarding this case, please feel free to reach to our team. Thank you very much.